So I actually think I have a very interesting perspective on this since I worked in liver transplant. So I would see the patient on the receiving side, and then working in neuro and trauma, I see the patient on the giving side. And so, in my experience, there are typically some sort of like cues, like some sort of GCS. I know in Wisconsin, if the patient had a GCS of like 3 or 4 coming in, that's an automatic. We're calling the donor network, just giving them a heads up on this patient, letting them know the situation. Also, letting them know like where we are in the process. Like, has the family been here? Does the family know? Like all that kind of stuff. And then it is the donor network's job, their person or nurse or rep, it is their job to discuss the process of donating organs with the patient's family. It is not the nurse's job. And I salute them for that because that seems like it would be very difficult. But once we move forward with that process, the donor network essentially takes over the patient's care, and now they're the ones writing orders for your medications. And your job as the nurse is really just to keep the patient stable. Stay on top of your drips, stay on top of your assessment, your vital signs, just stay on top of it. Keep the patient as stable as possible. And then once there is a recipient found for the organs, the donor network will, take the patient, pack them up, and either take them to the OR in that facility and, do what they do, or transfer them to a different facility where the patient receiving the organs is and do the surgery.